Hi, everyone. It's Dr. Jennifer Levin from Grief to Growth, and I'm here this morning with a sudden death insight. And I want to talk with you for a moment about what it might be like to be living with some trauma symptoms after experiencing the sudden death of a loved one. Now, not everyone experiences symptoms of trauma after they experience a sudden death, but some people do. And whether or not you experience some of these trauma symptoms has absolutely nothing to do with the relationship or the way that you loved your loved one. It just is the way that your body goes about processing the trauma or what actually happened. Now, there are four main ways that an individual or you might be experiencing trauma. These are physical symptoms such as headaches and stomach aches, general body aches, and maybe even physical symptoms that you are already experiencing that are all of a sudden getting exasperating. It's also common to have um, emotional or psychological symptoms. This might be anxiety, something we call hypervigilance, or waiting for the other shoe to drop. You might have mood swings. You might become very depressed. It's also common to experience what we call excuse me, it's also common to experience what we call cognitive or um, problems with your thinking, concentrating, difficulty focusing after a trauma. And finally, the last way is behavioral symptoms that you might have after a trauma. And these might include things like choosing to use a lot of substances to numb or not think about what's going on, tending to isolate, to stay away from people. Some people engage in high risk behaviors. So there's a lot of different ways that we may respond or, respond after experiencing the sudden loss of a trauma the sudden loss of a loved one. What I want you to know is whatever is happening is normal for you. You are experiencing a normal response to a very abnormal event, which is the sudden loss of a loved one. So don't be afraid to get help. Don't be afraid to talk to a therapist, to seek help from your doctor, to talk with family or friends, because the loss of a loved one is so devastating. As you know, it changes your world, it throws everything upside down. And trauma's no joke. These symptoms can develop into very serious things, very serious medical problems. I know you've heard of PTSD or other mental health issues. So get help if you're having problems functioning. You can't do your um, things around the house. You can't take care of yourself. You can't take care of others. You can't do your responsibilities at work or take care of your family, or you can't function at school. Take care of yourself. Be kind to yourself. You will get through this. Bye for now.